Yep.
Oh, okay.
Anytime.
Hi, I'm the pharmacist Anna. Are you picking up a prescription today?
Yes, I am.
Okay, could I get your name?
Joyce Smith.
Okay, so this prescription is for you. Could I get your birth date?
It's not on the form, actually. 8/18/54.
Okay, perfect. Just want to make sure we had the right person. So it looks like you're picking up a new prescription today. So would it be okay if I took maybe 5 minutes to go over it with you to make sure that you know how to take it safely and effectively?
That would be fine.
Okay,
Thank you.
perfect. So just before we get started, I want to verify some of your information that we have in our computer system. Could I get your address?
2507 University Avenue.
Okay, and your phone number.
299-1234.
Okay, and what medications are you taking right now?
I'm taking 4 for diabetes, high blood pressure, heartburn, and an antidepressant.
Okay,
I do know the names, but we'll
Sure,
go
we
with
have
what's
them
on
on
the
here.
form. So.
Perfect. Any allergies to any foods or medications?
No.
Okay. Are you taking any over-the-counters, herbals, or samples?
I take a woman's multivitamin
Okay,
over the counter.
sounds good. And it looks like you've been on the metformin, which is a diabetes medication, for 6 months now? Okay. So the medication that Dr. Nathanson sent over today is another diabetes medication. So it's Invokana, 100 milligrams. So did they tell you at all how you're supposed to take the medication?
Not a lot, just once a day.
Okay, and did they,
But
or
not-
how did they tell you that it was going to work for
They
you?
didn't really give me a lot of information.
Okay,
I think
perfect.
they're leaving
Well,
that for you.
Great, that is my job, so we'll go over it. So it's just going to be one every day.
Okay.
And it looks like there's 30 in here, and there's going to be 3 refills on it. So they want you to be taking it for the next couple months here to see how it's going to work for you. This medication is one that's going to continue to lower your blood sugar. Similar to the metformin, they're both lowering your blood sugar, but they're in a different class of medication. So this one is going to be just once a day, while the metformin was 1-2 times a day.
Right.
So do you think you have any concerns about remembering to take it every day? Or?
No, I'm very, very on point with that. It's
Okay.
important to me. To
Sounds
take that.
good. And how are you storing your medications?
They're just on the night table in my bedroom.
Okay. So this one, with your other oral medications that you're taking, you'll want to make sure you store it at room temperature, dry, cool place, away from children or animals in case they, got their hands on them. So if you did have people over at the house, just move them to a different area, kind of away from there. And since this medication is going to be used for your diabetes, did they tell you anything to expect with the medication, or how did they tell you to kind of watch
just
to see if
take
it's
it
working?
regularly. I think
Okay.
that's
That's definitely good advice. You'll definitely want to continue to take it every day so it can work the best to lower your blood sugar. Couple things you want to watch out for, since it is going to be lowering your blood sugar. If at any time you have really low blood sugar readings, or you feel shaky or dizzy at all, you'll want to eat some very quick carbs, because you're most likely having a hypoglycemic or like low blood sugar event. If it gets really bad that you feel dizzy and faint or something like that, you'll want to call the doctor. Along with this medication, since it is new, if you notice any sort of allergic reaction to it, your throat starts swelling, or you get hives or anything like that, definitely call the doctor with that one as well. So just to make sure that I didn't miss anything, do you have any questions? Could you maybe summarize some of the key points that I went over?
well, my question would be: is it is okay to take 2 diabetes medications?
Yes,
at
but the
same
biggest thing to
time?
worry about or kind of look out for was what I was talking about with the too low of blood sugars. That's something that could be kind of scary for people, and could cause the shakiness or the dizziness, and that can kind of happen for some people when they add on another diabetes medication.
But they're working on different things. They work
Exactly,
differently.
yep. They're
Okay.
different classes of diabetes medication. Metformin is kind of the staple drug that they start people out on, and then Invokana is another class of medication that sometimes they'll use to further lower your blood sugars and your A1C, which I'm sure you're pretty familiar with.
Okay.
Did you have any other questions for me?
No, I think that takes care of it.
Okay, and if you happen to miss any doses, don't double up on the dosing. And then If it's closer to when you would take your dose for the next day, just skip the missed dose completely
Okay.
and wait for the next day.
All right.
So yep, just take it once a day. Make sure to watch out for any side effects like the too low of blood sugar. And have a great day.
This is fun because I take no drug.